Hi, folks. This is John Adamson, the Rehab and Documentation Guru, and today is January 16th, 2020. And today, I'm going to talk about setting up the next level of care. I really think that therapists in different settings have a responsibility to the therapists in the next setting. And what I mean is this: you're in acute care. I think acute therapists do this well. You have a patient who's going to be discharging from acute care. You, based on your assessment, have a strong opinion of where that patient needs to go at the next level. I think you need to expressly state that and give good, solid, objective reasoning behind why they should go to that next level. Here's, related to that, a scenario. You're in acute care, you see a patient. Patient clearly should be 24-hour care, inpatient rehabilitation, or SNF Part A. They should not be going to home level. And you indicate very clearly in your notes that they should not be going to a home level. They go to the home, though, because of discharge planning and their insurance and whatever. They go to the home and then something bad happens to them. Now, they didn't necessarily want to go home. They were kind of forced into that situation because of payer restrictions or whatever. You have just provided that patient with the ammunition they need to get recompense for whatever injuries they've sustained. I'm not big into lawsuits, never have been, but I'm sure big on arming patients for getting the care that they need. So that's one reason a therapist should be setting the patient up very clearly for the next level. Here's the other thing. I'm in home health. I get patients sometimes that are orthopedic. There is a general trend that orthopedic patients from acute care will go right to outpatient, depending on their orthopedic needs. But they come to me sometimes instead. In the acute setting, or in the SNF setting, or whatever it might be where the patient came from, it is really important that that therapist indicates what the next level of care should be based on the patient's needs, what they think the patient should be going to. And they should be realistic, and they should be basing it on objective data, like what's the patient's balance score, what's their Barthel, what's their cognitive capability, in setting up the next therapist for success, because each of us basically has a responsibility for the next level of care beyond when we discharge the patient. So I in home health, most of my patients don't need to go to outpatient when they're done, because frankly they can do a lot of home exercises on their own. But I do have some patients that clearly should go outpatient. So I'm very careful to explain why they should go to outpatient, because I want to set up from a claims review perspective in the mind of the reviewer that somebody besides that outpatient therapist that eventually gets the patient needs to see them. And not only will that outpatient therapist who's developing a plan of care to see that patient be stating medical necessity exists for me to keep seeing them, but I'd like to back that outpatient therapist up by saying in the home health setting, the patient really does need outpatient therapy. So make sure you always look to the next level when you're getting ready to discharge your patient, and state very clearly what the patient needs to succeed. And I think that's going to be a win-win for the industry and the patient alike. John Adamson, the Rehab and Documentation Guru. Hoping you have a blessed day. Take care. Bye-bye.